A very good afternoon to you, Professor, and thank you so much for your time. So, of course, lack of intensive care resources is one of the leading factors for this issue, but what are some of the others that you guys have found?
So the first thing that we found, which was very distressing, is that the mortality in Africa is higher than any other region in the world. So we experience about somewhere between 11 and 23 excess deaths per 100 critical care admissions, and almost half of the patients admitted to critical care die. That's the first thing. The second thing, which is also extremely distressing, is that of all the patients who need critical care, only 1 out of every 2 referred actually get into critical care. And then once they're there, there's limited resources, so the therapy they get is less than it should be. And we estimated between 7 and 14-fold less than the therapy they should get for the severity of disease. So very distressing findings.
Is this expected to get worse now with new variants being discovered, with different waves that the world is experiencing, and of course the fact that Africa is not accessing vaccines as quickly as the more first world nations are?
I think you touched on the most important point. So, I mean, there's about vaccination, because the study shows that our critical care capacity is extremely limited. And one thing that vaccines does is it decreases the amount of patients who have severe disease. So really what we really should do now is try and rapidly vaccinate the continent. That's the only way we can address this resource limitation at the moment.
Professor, are there any countries that, of course, of those that you did this study on, are there any countries that are perhaps showing signs of any, positivity, signs that they could actually manage to deal with this situation and that the mortality rate won't continue to increase?
We didn't identify any countries as outliers in the study, so I think the findings are pretty generalizable across the countries and the hospitals that contributed to the study. So I think, if we need a strategy for Africa, the strategy needs to be, number 1, vaccinate as fast as possible. 2, we need to ensure that we got access to oxygen and steroid therapy, because we confirmed that steroids are protective. And then we need to look at a longer-term strategy, and that longer-term strategy is ensuring that we got adequate critical care resources for the future.
Are there any other factors, Professor, outside of those which you guys have identified and, of course, some of the solutions you've given, are there any other factors that are contributing to this mortality rate as it is?
So there are obviously patient factors which are contributing to mortality. So we identified factors which had been identified before, things like diabetes, increasing age, etc. And we also showed that HIV and AIDS is also associated with mortality, which hadn't been shown before. But the important thing is that we also showed that steroids are protective. So I think really we need to be driving to get these, at least steroids and oxygen, we need to get them to all the sites as soon as possible.
Are there any particular vaccines that you reckon that could, be better sourced or that should be sourced to perhaps help with the situation, dealing with it a little faster? Because I know you're saying that it just needs to be a matter of vaccinating quicker, but are there particular vaccines that maybe you feel, could be suggested?
I don't think so. I think the principle is we need any specific vaccine as soon as possible, and that really needs to be the drive.
All right, Professor, I mean, one of the obvious issues in Africa is a matter of money and a matter of accessing the money to get these vaccinations, especially as quickly as they're needed. How then does an African country, perhaps in West Africa, East Africa, one of the poorer countries, Zimbabwe even, for example, how do they then deal with this situation when they do not have access to the oxygen that they need, the hospital beds that they need, the proper resources in intensive care, and of course to get the vaccinations a little quicker? Are they able to then still deal with this situation without all of those things that are needed?
Extremely difficult question. I think what we're seeing is, the big issues are, one, vaccine inequality. I mean, we can't have countries hoarding vaccines when Africa isn't vaccinated. So, I mean, there's a big need for advocacy here. We're not going to be able to change the resources that are available in countries across Africa instantaneously. So we have to go for the easy deliverables, and then we've got to find a way of them being financed or managed. And the easy deliverables are the three things: they're vaccines, they're steroids, and they're oxygen.
Professor, thank you so much for your time this afternoon. That is, of course, Professor Bruce Biccard, who's of the University of Cape Town's Department of Anesthesia and Preoperative Medicine.